Hello, my name's Brooke, and today I'm going to choose a case, analyze the case, then work on a working solution for my patient. I chose case number 5.
Case 5, a 25-year-old woman who has been diagnosed with severe obesity and can no longer work for a living. She has been housebound for a few months and finds it hard to get out of bed. I have diagnosed my patient with severe obesity. This is a serious health condition that results in an abnormally high body mass. Obesity is diagnosed by having a BMI, body mass index, greater than 88 pounds or 40 kilograms. You can also be diagnosed if you have a BMI greater than 77 pounds or 35 kilograms, and you have at least one serious obesity-related condition. Lastly, you can be diagnosed if you have more than 100 pounds over IBW, ideal body weight. But what's the difference between your BMI and your IBW? Your BMI is your weight in kilograms divided by your height in meters. A high BMI is a common indicator of high body fatness. You can check your BMI by using this website. Just type in your height and weight, then it gives you a number. This determines your BMI, but at times it can be inaccurate. A IBW is a certain weight that is believed to be maximally healthful for a person. Your IBW is based off your height, but it is modified by the factors such as gender, age, build, and degree of muscle. This disease affects my patient in many horrible ways. There are a lot of health risks that can increase for someone who has this disease. Some of these debilitating and deadly diseases include diabetes, heart disease, and some cancers. Not only is obesity associated with many physical diseases, but also many mental health disorders. These disorders include anxiety, depression, bipolar disorder, and eating disorders. Many of these issues come from weight discrimination by other people. When you have excessive weight, it affects every aspect of your life. Your body is constantly struggling to continue living a normal life. It is hard to keep up with your family, friends, and coworkers. You end up feeling tired and sore because every part of your body's system is being overworked. One of the most devastating effects of obesity is restricted mobility. You cannot move because of your weight, but if you can't move, it's harder to burn calories and lose weight. Your metabolism will slow, and your weight will slowly increase. Once you're already slightly overweight, it is hard to get out of that cycle, and most people continue gaining weight. People's health slowly declines and diminishes over time. It is hard to battle your way out of this, but not impossible. Here are some of the short-term and long-term effects of this disease.
Shortness of breath during activities, high cholesterol, high blood pressure, joint pain and inflammation, headaches and physical discomfort, digestive issues, infertility, restricted mobility, fatigue, and psychological distress. Heart disease, stroke, sleep disorders, venous ulcers, gallbladder disorders, COPD, chronic obstructive pulmonary disease, cancer, particularly in the colon, kidneys, breast, uterus, and gallbladder, depression, social isolation and discrimination, and decreased lifespan by 10 to 15 years.
Living a healthier lifestyle can fight these symptoms of obesity. Before getting to the stage of diagnosis, how can my patient prevent or work on her obesity? She can start by eating healthy. This means eating lots of fruit and vegetables, choosing whole grain foods, eating protein foods, limiting processed foods, and making water her drink of choice. Being physically active is also very important as physical activity burns calories and a calorie deficit results in weight loss. My patient can also manage her stress in a few different ways. This should help her on her weight loss journey. That's because researchers have found many people who live a mindful and stress-free life are less likely to gain weight and avoid emotional eating. Getting enough good quality sleep can be tied to weight gain. Ghrelin is a hormone that is produced to make you hungry and eat more. When you are sleep deprived, this hormone is produced more often, which eventually leads to gaining weight. But what if my patient is already diagnosed? How can she fight the symptoms of obesity? After the doctors taken her health history, done a general physical exam, calculated her BMI, measured her waist size, and checked for other health problems, it is now time for treatment. The goal is to reach and stay at her target healthy weight, or her IBW. She may need to work with a team of professionals, a dietitian, a behavioral counselor, and an obesity specialist, and that's okay. They will help her understand and make changes in her eating and activity habits. The first thing she'll have to work on is making some dietary changes, including cutting calories, feeling full on less, making healthier choices, restricting certain foods, and meal replacements. Then she can focus on exercise and activity. She'll have to keep on moving by doing these regular aerobic exercises. These can reach from going on a treadmill to going swimming, and by just parking her car a little further away from the store entrance. She will also start going to support groups and counseling to work on her behavior changes. Alongside that, she may start on weight loss medications. Her healthcare professional can prescribe her a medication to use during her recovery. These medications include
bupropion, naltrexone, liraglutide, orlistat, and semaglutide.
She may also have procedures for weight loss, such as
adjustable gastric banding, gastric bypass surgery, gastric sleeve, gastroplasty, or an endoscopic sleeve.
Remember that your health plan is not just about your physical fitness, but also your emotional support and coping skills. If I were to put myself in my patient's shoes, I would quickly find out how horrible life would be in her body. I personally am a very active person. I devote my life to soccer, and I can't imagine not being able to play it.
Yeah, Katie!
Because of this motivation, I would quickly change my lifestyle in some major ways. Changing this lifestyle would also increase my chances of living longer. The first thing I would do is work on my eating habits. I would hire a dietitian and work out a diet that's best fit for me. I would stick to this diet and be very disciplined because I know how much this disease holds me back from the things I want to do in life. I would then start exercising, which I know would be very painful, but I would try my best. I'd start small and continue my workout more and more every day. After getting myself the help I need, I believe I would be able to change my life around. For my patient, I'd like to start by talking to her and making a health plan that she has to follow. She'll be given a strict diet and simple workout plan. Depending on her progress, I might prescribe her a weight loss medication or surgery. I would also like to get her counseling for possible mental health issues or eating disorders. I wish her the best and hope she can continue down this path of recovery. And thank you so much for listening.